Questions on relationships, depression, ADHD, and extreme mood swings in children are all part of our Ask the Doctor segment today. Dr. Joshua Weiner joins us with the answers this morning. Good morning to you.
Good morning, Barbara.
Welcome. We've got quite a few, so let's get started. We have one from a woman who is living with a married man, and she writes, "We've been living together for over 20 years. Together we have 29 grandchildren. We've talked about marriage, but he's yet to divorce his wife." What do you say?
Well, I say, first of all, the email goes on to say that the house that they own and live in is only owned by him, and her name is not on the title. And I think what she needs to do, first off, is she needs to sit down with this man. She needs to read him the riot act. He needs to understand that her depression and her suicide attempts in recent years are at least in some part due to the fact that he has not been willing or able to leave his wife, even though he's been with this woman for 36 years.
Could there be some financial reason for not wanting to divorce the wife?
You know, who knows? I don't know, but one thing I do think is that she needs to contact a lawyer herself, and she needs to find out what she's entitled to, given that she spent 36 years with this guy. They've been living in the same house together for 20 years, but yet if he dies, none of it will go to her. It'll probably go to his wife.
Yeah, I guess she does need a lawyer in that case. Okay, let's move on to the next question. I'm a 21-year-old college student. I have been depressed for more than 3 years. I've tried at least 5 different antidepressant medications, and I've also been in therapy, but neither has helped. I've thought about suicide, and I'm desperate for some help. What can I do?
Well,
Any answers?
I have a couple thoughts. One is that I don't know whether this person has been seeing their internist or whether they've seen a psychiatrist, but I do think it's important to see a specialist. I think if you're dealing with these problems and they haven't been fixed yet, you want to see somebody who deals with this all the time. Secondly, I think this person may want to consider something called electroconvulsive therapy. This is the old shock therapy. We know that antidepressants work in about 65% of people, and they take about a month or two to work. Shock therapy works for about 93% of people, and it works within days. Electroconvulsive therapy is still the most effective treatment we have out there.
Well, is there side effects from that?
The most common side effect is some short-term memory loss, which can last for about a month, where you just forget some of the things that occurred around the time of your treatments. But otherwise, it's generally very well tolerated and very effective. In fact, I have a college patient in my practice who just had ECT. I talked to her yesterday. She's doing phenomenally well. So this stuff does work.
Help solve depression. Let's take this question on ADHD. I'm the mother of a 4th grade boy. His teachers think he may have ADHD since he's easily distracted, hyperactive, and very forgetful. I notice these things at home too. However, he is able to focus for a long time when he's doing things he likes. So, does he have ADHD?
I think it's still very possible that he may have ADHD. This is one of the common misconceptions that people have, and I hear this a lot in my practice. They'll say, but he can concentrate for a couple hours when he's reading something he likes or playing video games. There are people who have the worst cases of ADHD, but when they're interested in something, they can do hyper-focusing, where it's actually very hard to pull them away from something they're interested in. So this does not discount the possibility of ADHD.
So he needs to be tested.
Absolutely.
Another question now, finally, the last one. My 8-year-old son is generally happy, does fine in school, and has lots of friends. However, when he gets really upset or angry, he sometimes says he hates himself and wishes he was dead. He will also hit himself in the head with his fists. We worry about the behaviors and wonder if this is a sign of a psychiatric problem.
I would actually say they probably don't have too much to worry about right now, because it sounds like he's doing very well socially, and he's got lots of friends. He's generally a pretty happy kid from the email. And when children are really upset, particularly at this age, they sometimes will do these sorts of things. And I think it's largely as a way to express their frustration and also to get some negative attention from their parents. So the one piece of advice I have for the parents is to just ignore it. Walk away. Don't make a big deal out of it, because if you make a big deal out of it, you're likely going to encourage him to continue to do this.
Sounds like good advice to me. Thanks so much.
Thank you, Barbara.
Always good to see you, Dr. Weiner.
Take care.
We'll see you next week.